the Nigerian Medical Association, as NMA, is disturbed by the death of medical doctors as a result of COVID-19. NMA President, Professor Innocent Ujah, says 20 medical doctors have died within 1 week as a result of COVID-19. The Doctors Union is now calling on the government to train health workers in infection prevention. Well, let's deepen the discussion now. As chairman, Nigerian Medical Association NMA Lagos branch, Dr. Adetunji Adenekan joins us. Good to have you join us here on Newsday, Dr. Adetunji Adenekan. Let's begin by commiserating with you first on the death of your colleagues. Then we'll go on to the issues. Well, the doctors have paid, as it were, the supreme sacrifice. Could this, doctor, have been prevented?
Thank you very much, and thank you for having me. Compliment of the season. I must say that this is indeed a sad period for us as health workers, and more especially as doctors within the country, to have lost that much number of colleagues within the workforce. Of course, the death of one colleague is equivalent to about 4,000 to 6,000 citizens of Nigeria who are going to be disserviced because of one loss of a doctor, because of the ratio. I must say that what we try to preach to everyone is that all our colleagues should treat all patients who are presented to them as presumed COVID-19 positive. And we also humble appeal to all our patients or anybody presenting to any facility to also tell us about their status if they have done the test. But what I have noticed is that people are not even doing the test as it should be done. Neither are we carrying out the test as it should have been done. We begin to do tests only when people have symptoms. But what about somebody who do not have symptoms and want to know their status? But what I think we should go with is that everybody needs to be trained in invention, prevention, and control. And everybody needs to follow the guidelines. So this has been going on for a while now. But every doctor is expected, or every health worker should be trained in that area.
I just want to reiterate the question my colleague just asked about whether the deaths could have been prevented. We know earlier on, when the doctors went on strike, one of the issues they mentioned was the lack of PPE, the protective equipment. Is that now being made available to them?
Yeah, the truth is that, yes, we are having some preventive measures being given, but in some areas it is not adequate. So it's not generally adequate in the country. But yes, could the death have been prevented? Maybe, because some of them, as basic as oxygen, was what one of our senior colleagues needed. And because he couldn't get that to sustain himself, because you look at the whole system. That's why I say that's why COVID-19 seemed to have affected a lot of, even those health systems that we felt they were okay, but with COVID-19 they realized that it's not as effective as it should be. A doctor needing an oxygen care, and he couldn't get it. From one center to another, he was being transported until he got to the final area. Before he could get there, he had died because he couldn't manage it. He also had an asthmatic condition. What we are saying that some of these deaths can be prevented if we look at our healthcare system and make sure that every needed equipment or facilities are available. It's not everybody that can rush to get to the center where they need it. What about the peripheral hospitals? What are we doing about our private hospitals? Are we equipping them enough to be able to save life? If you want to go to all those centers where we think it's only those centers that should have things that will be available, then we will have lost a lot of patients. As a colleague, or as members of an association, what we are preaching is that the welfare, the security, and health of our members should also be taken into consideration, knowing that we are 3 times higher risk of contacting this COVID-19 than any other person because of the work that we do. So it could have been prevented, I must say, because looking for oxygen should not be a basic source for someone to lose his or his life. It should be a readily available thing.
Yeah, doctor. Well, some doctors, incidentally, have contacted COVID because of, or rather, as a result of patients' medical history. They did not reveal their history, and that's very dangerous for you doctors. How are you working, or what are you doing to get around this?
I must say the truth is that we are not going to rely on patients telling us whether they are COVID-19 positive or not. What we need to do is to make sure that all our members protect themselves and their families. You assume or presume that every patient you are seeing is COVID-19 positive. Again, in the real sense, it may not be as nice as it appears But it's best you protect yourself to assume that the patient sitting in front of you or walking into your consulting room is COVID-19 positive until proven otherwise. So you can guard yourself, wear your personal protective equipment, keep your distance. If you don't have all it takes to see a patient, do not attempt to see that patient because you are not protected. And in a way, all this room about where do we see patients, open environment, people seem to have gone back to the usual clinic that we are running because we feel like it's not safe to do so. But at the time, we're running clinic in an open environment, in the open air, so that there is, you don't create an eddy current within the room where you're sitting, so that is a wind, the wind blowing away whatever it is, and you keep a particular distance. For some particular specialty, they are stopped seeing patients for a time, but now they have started again, and we encourage all our members to as well protect themselves and assume that every patient they are seeing is COVID-19 positive. But be that as it may, I will say that when we lose members, it is saddened that we don't see government effort in trying to placate the members, the family. Those that have died, those insurance that the government promised, how many insurance did they do? Those people that have died, what is going to happen to their families? What is going to happen to those that are still frontliners, that are still being held up to 4 months allowances? What is going to happen to what government promised? Government said they were going to pay 6 months COVID-19 allowance. They paid only 3 months, and that was the last we heard of it. What is happening to the negotiation on hazard allowance that is still 5,000 up to now? It's everything seem to have gone down, but now we're talking about second wave, and it looks as if it's picking up again. Why should there be this interlude? Why should there be this interval of no activity to what you have promised to do to health workers who have sacrificed their life? Whether we get paid the money or not, I can assure you, we'll keep working because that is our calling, and we'll keep doing the best to save Nigerians. I'm glad you went there, Doctor, because I was going to ask about the dependence of the doctors that lost their lives in the course of their job. But then I hope it's not a case of us being penny-wise, pound-foolish. What is the morale of doctors? I know you say you'll keep working in spite of everything. In the midst of this kind of news, what is the morale like among your colleagues? I can tell you that, yes, morale is low. But I must tell you that what we as leaders need to do is to keep sacking our members to boost their morale. Because for us, the moment we take that oath, when we are inducting, we are sworn to preserve life and to make sure that we minimize deaths. What we are trying to do is to make sure that we don't begin to, I'm sure you are aware that even within this COVID period, a lot of doctors have left the country. And that's part of thing killing their morale. But some of us are determined to make it better. But those of us that are still on ground, we need to protect ourselves. We need to be well encouraged. You don't give us promises and you start the first part of it and we don't hear anything again. But like I said, our driving force is not that. Our driving force is that we take solace and we take courage and we also live in the atmosphere where we are able to save life. That is the joy of every doctor. That's the joy of every health worker. When you save life, in fact, you can get to your house and have a drink on that because you are happy you rescue someone from death. But when you don't have all that it needs to do, you have done your part, but you need some other resources to work with. And these are the reasons. But yes, motivation is very important to any workforce. And we want to be motivated, but if government feels that we are not desired of that alone, or we don't deserve it, it's not enough for us not to do the work, because this is the best time we can showcase that Nigerian doctors are dedicated and committed to saving lives.
Let me refer to what the President said. The President notes that the health workers are operating under severe limitations. Now, what are these limitations, Doctor? Are you satisfied with the efforts of government to change the status quo, that is, improve on the limitations? And what is your organization, the NMA, doing concerning these limitations?
Okay, I will say something that now I'll move away from welfare packages. I'm going to go straight into what we used to work with. Now, when you are giving people consumables, it's only important that you know that when you consume it, they become depleted. They reduce the number. So you should have more stock. So when you have depleted consumables and you don't get them restocked, then you begin to talk of lack of shortage of such equipment or facility, or as the case may be, instrument. So in this case, we need to keep having inflow of those things that we need to work with. You can't say get away there and say there's no face mask for you to use. You know how many face masks you might end up using in a day. There's an N95 or N3 face mask. You need to make sure that these things are available and readily accessible to use for everybody. Now, when you see people that are working in the isolation, they're also short-staffed. Some people have been disengaged because we felt that we don't need that much number. Now the numbers are beginning to rise. Are they going to engage more people? These are also areas where we are preaching. And another part we are talking about is that government need to find a way to make sure that we find a better way to approach this thing. It's not only, like everyone is saying, you don't have to copy what is going on in the other countries verbatim. There are some things peculiar to us. And if you listen to the commissioners, the interview from the commissioner, we are looking at things holistically the way it should be in our environment. And what NMA is saying is that we need to use our indigenous health facility to look at how we behave with COVID-19 and what we need to do to make sure that we contain the virus and we don't have to copy everything verbatim. So NMA is saying that we should continue to sing the song of non-pharmaceutical prevention and containing the disease. People don't wear face masks anymore. People do not even keep physical distance. People do things. I saw a lot of over the weekend, yesterday, some social centers were sealed. And when I saw the videos, I could imagine how many people could have gotten what and what not. They have not tested there. But what we are saying is that everybody should behave like the next person to you is COVID-19 positive. It is not supposed to be a stigma. It's supposed to be a way for precaution and for invention, prevention, and control. So we keep talking about it at every forum that we have, a forum, we keep talking about it, that governments cannot stop what they are doing. They can only improve to do more from what we have presently. Talk about COVID-19 second wave. Do we have a second wave? Some people believe we do.
All right,
because
Dr. Adetunji, we'll take a break now and be back to you. Just hold on there. We'll be back in a moment. Stay with us. All right, we still have Dr. Adetunji Adenekan, the chairman, Nigerian Medical Association, Lagos branch. Good to know that you're still there, Doctor. Let's... More than 1,000 health workers have tested positive for COVID-19 in Nigeria, especially due to the non-usage of the full PPEs. Now, the question is it the carelessness of the doctors or the lack of enough PPEs that is causing this?
I think I will answer by saying that when you talk about PPEs, it depends on where you're working, what you're doing at that point in time. The PPE that somebody who is in the clinic will wear is different from the kind of PPE that somebody who is in an isolation center will wear. So these things are not universal to everyone. Depends on what you're doing actually. But what we are saying is that we need to have enough of all these PPEs. I cannot directly say that it's because of lack of PPEs that doctors have died. I would say here that we need to make sure that everyone is trained under the infection prevention and control measures. We need to be sure that our members are also doing the right thing at point of duty. And like I mentioned earlier, every doctor or every health worker should treat every incoming patient as COVID-19 positive, and so they should protect themselves. I want to say something here. You said you are going to insure all doctors that so it's a volunteer to be frontliners. Where is the insurance? Where's the insurance? But what I'm trying to say is that for PPEs, lack of it is not enough to say that that's why people are dying. There's a lot that can be gained from prevention of some of these things. And those are the things to look at.
Okay, Dr. Adetunji, prevention is definitely better than cure. What are we doing in terms of campaigning to have access to the vaccine when it arrives? We are told we should expect it to arrive as early as January next year. So are we hoping that the health workers will be the first in the rollout?
Yeah, like I mentioned in one of the interviews I had in one of the TV stations, yes, we will expect that health workers, just as is expected, we are 3 times higher risk to contact the disease, and we believe that we should be one of the first, just like elderly people with other comorbidities should also be joining with that, and we will expect that this should be given free to all health workers. Whether you talk about the importance of having the vaccine now or not, I can assure you that we would rather prevent it, because you don't even know. People talk about different strain of another second strain. You don't even know which one you'll be exposed to. So for the vaccine that we know now, we would rather get that shot, and begin to develop our own form of immunity. Nobody knows what strain anybody was exposed to. But with all the myths going around the vaccine, part of our job is to make sure that we disabuse people's mind, we educate people, we increase awareness on prevention, and we also increase awareness on talking about the vaccine so that we can remove all the myths that that's coming around the vaccine and all those things. What we know is that we discuss evidence-based research and medicine, and those are the information that we want to be able to give people. But permit me to use the opportunity to say that we are aware that even at the airport, people are cutting corners and getting negative results even when they have not done the test. This is very, very bad, and it shouldn't be happening. That people will genuinely do a test just to travel, and they will find out that they are negative. They go on board. Why not knowing that there are other people who are on board of that aircraft that did not even bother to do the test, but they paid their way out at the airport and they got the negative result? That shouldn't be happening. It should be, in fact, the people involved should be looked for, and they should be dealt with severely. It shouldn't be happening. That's dangerous. This is not something like I don't even know. I don't know.
That's sorry, but well, I don't know. You may have your facts, but for now, it's an allegation. But it's dangerous for anybody at all to do that, Doctor. You talked about infection and control prevention measures, training people. What will this really involve, and who will be involved or in charge of this training? Is it your organization, the government? How will it be worked out? What does it really involve?
I'm going to tell you that everybody needs to be involved. We talk about gatekeepers when you go to the community, and we talk about the religious leaders. We talk about the traditional rulers. Everybody needs to be involved, apart from government. Now, in the medical field and in the health facility, the way we take you on how to prevent infection might be different from somebody who is at home. But the bottom line is that you teach people based on what they do regularly, their daily activities. That's how you can teach them. I must tell you that till today, some people don't know how to wash their hands. You see people washing hands, all they do is put water, put soap, and they wash. They don't wash properly. But if you go through some of these training, you will see that you need to wash your hand for close to 20 minutes. And there are different maneuvers and movement that you have to make to be sure you have covered everywhere. But even as little as hand washing, you can't say it's properly done. But that's why we say that even if you can't get to do that, try to sanitize your hand.
Doctor, I'm sure you meant 20 seconds, not 20 minutes.
Pardon me?
I'm sure you meant 20 seconds, not 20 minutes.
No. I mean 20 seconds. But what I'm saying is that you keep washing and washing up to that, to make sure that you move around up to the wrist. There's a way you wash your hand, wash your thumb, wash in between your fingers. But people don't get to do that. They just rub their palm and rub the back of the hand, and they wash it off. I'm not sure whether they wash off all the soap and all the lather. But what we are trying to say that we need to keep showing this thing. We need to be telling people how to do this. That's part of what we call our infection prevention and control. If you are seeing a patient within the hospital, what's the distance? What's the kind of room we are running your clinic? Where should your patient sit? The way a patient should sit in a particular clinic might be different from the way it should sit in another clinic because of the architecture of the room where they are sitting. Now you have to watch the current, the way the wind current blows in that room. So these are part of the things that will be looked at. Even when you want to wear your glove, there's a way to wear it. If you want to wear the docking and donning, there's a way to wear it. All these are very important. But when you go to the community level, you have to be able to teach people how to go ahead to make sure that they are safe. Because people are with families and friends, they remove the face mask, but they don't see that as being in the public. But when they want to go to somewhere else, they put the face mask on. You will find out that it's when people want to talk. That's when they remove the face mask. When the face mask should be on is when people remove it to talk. When they finish talking, they put it on. Sometimes we need to do more, and we are working to make sure that at every opportunity that we get, we keep to educate people that we need to prevent the infection. There is no need trying to find out how your body will react to the disease. You may not be that lucky to be one of those that will get through it. So don't get it. Prevent it. That's the message.
Yes, Doctor. If you don't mind, I just want us to emphasize again the role you'll be playing in terms of enlightening your members as well, because sometimes we give the impression that doctors suddenly stop being Nigerians just because they're doctors. We're all in this together. So I'm just wondering, even in the issue you mentioned about demands that you have that are not being met, what if those demands are not met? How do you intend to forge ahead? What more efficient way do you intend to operate so that in spite of the limited resources, because it's certain that the resources are limited, prevented, you will continue to perform optimally. And also to enlighten your doctors to also adopt these practices you're preaching, because it is certain that they're not blame-free.
Yeah, thank you very much. I must tell you that we are also playing our part, giving out personal protective equipment, giving out sanitizers, continue to educate people. We are playing our part in this area, apart from rendering the service for which is our calling. I must say here that we are not going to wait for that. We are just reminding government that we are not doctors who only look at the welfare of us ourselves alone. All our I don't want to use the word profit, that's not the right word. Our gain, let me put it like that. Our gain in all this we are doing is when we are able to save lives. That is what makes a doctor or any health worker happy. And you will see us when we are waving our patient who has been discharged, the joy in that. So that will be our joy, to see that we have that reduction in the rate at which people get positive, reduction in mortality, and make sure that we have a healthy nation. So, because I would say to you, I'm not sure we want to go around the other time where we have to go on lockdown. But people seem to have forgotten all that was done then, all the sacrifices that everyone made, including the frontliners and them that decided to sit at home while we work to keep them safe. But people seem to have forgotten that everybody has thrown everybody into the bin and it's trying to do life as usual. But finally, I will say that for us, all we are doing is to make sure that we'll keep even helping our members to make sure they are prepared. There are a lot of times that we have given out PPEs, like I mentioned, just to support what government is doing. But when it comes to what we are known for, medicine, we will be there, and we are always there. That's what I need to say. But like you mentioned, not even some of our members are not blame-free, but we need to keep educating and making sure that people adhere strictly to those guidelines and protocol as rolled out by the NCDC.
For sure. Dr. Adetunji Adenekan, Chairman, Nigerian Medical Association, Lagos, thank you so much for being on Newsday.